everyone, and welcome. Today we're diving into a global health issue that, believe it or not, affects 1 in 10 adults all around the world: diabetes. We're going to break down the numbers, get into the science of what's happening in the body, and, most importantly, talk about what we can actually do to fight back. So, to really get a handle on just how massive this is, let's start with a pretty staggering fact from the International Diabetes Federation. Right now, as we speak, 1 out of every 10 adults on this planet is living with diabetes. That's more than 500 million people. Just let that sink in. And, the cost is just as mind-blowing. This year alone, the world is spending around $1 trillion on healthcare for diabetes. This isn't just a health problem. It is a huge, huge economic challenge for all of us. Those numbers are just wow. But to really understand why you hear diabetes called a silent global epidemic, we need to dig a little deeper into the data. And here's the thing. This problem isn't standing still. It's growing. The number of adults with diabetes is on track to jump from 589 million today to over 850 million by the year 2050. This is a crisis that is getting bigger every single day. What makes this even trickier is that so many of these cases are hidden. A huge number of people with the most common form of diabetes, type 2, live with it for years without even knowing they have it. And that, unfortunately, leads to much more serious health problems and, you guessed it, higher costs down the line. Okay, so we've seen the sheer scale of the issue. But what is diabetes, really? Let's take a minute to break down the actual biology of the condition and look at its main forms. So at its very core, diabetes is all about a hormone called insulin. Insulin is what helps our bodies take glucose, sugar, from the food we eat and use it for energy. When you have diabetes, your body either doesn't make enough insulin or it just can't use it the right way. And the result? All that sugar builds up in your blood. But here's something that's really important to get. Not all diabetes is the same. The condition actually shows up in a few very different ways. The two big ones are type 1 and type 2. The easiest way to think about it is that type 1 is an autoimmune condition. Your body is basically attacking itself, and there's nothing you can do to prevent it. Type 2, on the other hand, is different. It's when your body starts resisting the insulin it's making. It's often linked to things like genetics and lifestyle. And this is crucial. Type 2 can often be prevented, or at least delayed. And that is why talking about prevention is so important. Check this out. Type 2 diabetes makes up more than 90% of all cases. That means the vast, vast majority of this global epidemic is the type that we have some control over. We should also quickly mention 2 other key forms. First, there's prediabetes. This is like a critical warning light on your dashboard. Your blood sugar is high, but you're not quite at a type 2 diagnosis yet. And then there's gestational diabetes, which can happen during pregnancy. It usually goes away after the baby is born, but it does increase future health risks for both mom and baby. So what does this all actually feel like? What does it mean for a person's day-to-day health? In this next section, we're going to cover the warning signs you need to look out for and what can happen if the condition isn't managed properly. Often, your body will send some pretty clear signals. Because it's trying to get rid of all that extra sugar in your blood, you might feel super thirsty or have to go to the bathroom all the time. And since your body isn't using that sugar for fuel, you can feel exhausted or even lose weight without trying. Recognizing these signs is absolutely crucial for getting an early diagnosis. So, why is catching it early so important? Well, because if that high blood sugar is left to run wild over time, it can cause some really severe and permanent damage all throughout your body. And the long-term complications are no joke. Uncontrolled blood sugar wreaks havoc on your blood vessels, which dramatically increases your risk for heart disease and stroke. It can also lead to serious nerve damage, kidney failure, and can even cause blindness. Okay, after talking about those pretty serious risks, it's so important that we shift our focus to the solutions. This section is all about empowerment. It's about how we as individuals and our healthcare system can manage and, crucially, prevent diabetes. The great news is that the keys to prevention and management are really clear and totally actionable. The pillars are what you might expect: maintaining a healthy weight, getting regular physical activity, and eating a balanced diet. But these aren't just vague suggestions. They are incredibly powerful tools for taking back control of your health. And of course, the healthcare system plays a huge role. Diagnosis is done with simple blood tests, and treatments can range from pills to insulin. But you know what one of the most powerful tools is? Education. programs that actually empower patients with the knowledge and support they need to manage their own health effectively. That's a game changer. All right, for our final section, let's zoom back out, because this isn't just a challenge for individuals, it's a massive challenge for all of society. So, how are governments and public health organizations stepping up to tackle this epidemic on a much larger scale? The economic burden, as we've seen, is immense. And while the direct medical costs, hospital visits and medicine, make up the biggest chunk, those indirect costs from people being too sick to work, well, they put a huge strain on our economies too. So, in response, public health leaders are fighting back with a multi-pronged attack. This means being proactive with things like national prevention programs and widespread screening. It means policy changes like taxes on sugary drinks. And it means continuing to invest in research to find even better treatments. Because ultimately, you can't solve a problem this big in a vacuum. It really takes a village. An effective response absolutely requires a coordinated effort, one that combines smart public policy, engagement from our communities, and a strong, fair healthcare system for everyone. Which brings us to one final, really crucial question. We started this by saying that 1 in 10 adults has diabetes today, but the projections show that number climbing to 1 in 8 by 2045. So, knowing everything we now know about the causes, the risks, and the solutions, are we as a global community truly prepared for what's coming next?